So my name is Sarah Jarvis. I'm a nurse and I work as a clinical lead for substance misuse in one of the prisons in the southwest of England. And it's lovely to be chairing this event this evening with you all. So the RCN, for those of you that are not aware, the Royal College of Nursing is a UK membership organisation that works to support nurses and improving outcomes for the patients that all of us nurses work with. I understand we've got a number of people here this evening from various parts of the world, so welcome to everybody. The RCN has various forums for the different types of nursing that we work within, and this event is part of the library and museum exhibition series that is running at the moment called Prison Nursing Unlocked. And this was put together in collaboration between the Nursing and Justice and Forensic Healthcare Forum and also the History of Nursing Forum. So our event this evening is going to be dealing with some themes around custody and forensics, and it will be there will be reference to addiction and maybe other distressing topics could come up. So be kind to yourselves, and if you feel like anything is overwhelming at all, then please do feel free to step away if you need to and rejoin the session again if you feel able to. And we will be signposting at the end for further support if anybody does need any further support around anything that's been discussed this evening. So in terms of our Zoom facility that we're in this evening, many of you may already be familiar with Zoom, but just to let you all know that everyone is muted throughout the event to ensure smooth running of the event this evening. We also suggest that you may want to turn off your videos if you're having any issues, because that could impact on your connectivity. So you may find turning off the video, and there should be a button to do that with a camera on the towards the bottom left of your screen. If you're having trouble at all with Zoom, you may want to just try and leave and rejoin the event if you get any technical issues along the way, but hopefully that won't happen. And I think some of you have already been introducing yourselves in the chat, which is lovely. There is a question and answer function also, so please do put your questions in there as they arise, and then once we've heard from both of our speakers this evening, we'll be going through those questions and answering as many as we can. We may not have time to get through every question, but we'll try our best to get through as many as possible. So do put any chats that come up, any questions, sorry, that come up along the way. Okay, so that's all of our little housekeeping bits. So, and I think I'm really excited to be here this evening because as working clinically in a prison environment, I've got a keen interest in addiction in the role that I do, and also bloodborne viruses. So I'm really looking forward to hearing from our speakers and what they have to share with us this evening. Our first speaker this evening is Dr. Janet Weston, who is a historian and director for the Centre for History in Public Health at the London School of Hygiene and Tropical Medicine. And her research and publications have addressed histories of mental health, public health, forensic psychiatry, and healthcare within prisons. And this evening, Janet is going to speak to us about the impact of HIV and AIDS on drug use in prisons. So welcome, Janet, and I will hand over to you now.
Thank you very much, Sarah, for that introduction. And thank you to other Sarah Cheney, for organising this event. And thank you to all of you for being here. This is wonderful, and I'm really pleased to be able to talk to you a little bit about this history. Let me have the traditional pause while I share my slides. And I'll explain a little bit as well, a bit more about who I am. So as Sarah mentioned, I'm a historian. So I'm not a nurse, I'm not a healthcare professional of any kind, but I am the director of this history centre over at LSHTM. And what really brought me to this topic that I'll be talking to you about today was the research project that you can see in the middle of the slide there, Prisoners, Medical Care and Entitlement to Health, from 1850 to the year 2000. I was part of the team working on that project a few years ago, and I was very much the sort of contemporary correspondent. So I was looking at the end of the 20th century, the most contemporary part of that history. And my particular focus was on the impact of HIV and AIDS on prison healthcare. Which ended up also taking in a lot of issues around addiction and drugs. And that research included lots of archival research, but also oral histories and a witness seminar. And I'll be drawing on a bit of that today. So if you hear me mentioning having spoken to people, then it's those oral histories that I'm talking about. And just to say that if anyone is interested in finding out more about this, there is a free to download chapter in the book shown on the right hand side of the slide, which goes into all of this in a bit more detail. So that's what I'm bringing to this talk today, really, the history of drug use in prisons and how prisons have responded to drugs and the impact of HIV and AIDS on all of that. And I do hope that any of you in the audience who remember the 1980s and 90s might find that some of this resonates with your memories, but I would be really interested to hear or to see in the chat what you think, whether it does match up with your experiences, and also what you think has changed in the last 25 or so years. Because I will freely admit that my expertise ends around the year 2000. But let's go back in time then a little bit and go back to the early part of the 20th century. I'm looking in particular at the history of heroin because that did become a particular problem for prisons at the end of the 20th century. But people had been taking heroin in Britain in various forms for a very, very long time. But it had previously been seen as a very different sort of problem compared to what it became in the 1980s and 1990s. So for much of the 20th century in Britain, addiction to opiates was really seen as a strictly medical problem. It was understood to affect a very small number of people, mostly in London, and it was something that GPs would manage by prescribing, by what we would now think of as sort of maintenance prescribing. They would prescribe heroin or morphine. And on the slide here is a sort of artist depiction, if you like, of a typical heroin addict, a middle-class white man, or possibly the doctor. So for a good chunk of the 20th century, heroin addiction was very much an issue amongst doctors, or rather a large proportion of heroin addicts were doctors because they had the ready access to heroin. And heroin addicts who weren't doctors, by and large, had been prescribed heroin in the first instance by their doctors. So it was a very small problem. It didn't cause a huge amount of concern, and it was just managed by doctors in the normal course of their practice. But moving towards the 1960s, 1970s, perceptions of heroin use really began to change. And there's a selection of headlines here from that time. These are all from the Times, so they're quite sort of sedate headlines, really. You can probably imagine what the equivalent headlines for these news stories might have looked like in the tabloid press. But as you can see from here, the problem is really sort of changing. There's a lot of concern about doctors prescribing excessively, doctors not refusing anybody, junkie doctors in scare quotes. which was as much about doctors sort of posting heroin prescriptions all over the country as it was about doctors taking heroin themselves. There was a lot of concern about young people, youths in Soho here, getting drawn into heroin use, and a very strong feeling that things were perhaps getting out of control. So around about the 1960s and 70s, the problem of drug use in a general sense was really shifting from a medical one to a much more social one, and indeed a more criminal problem. There was a lot of new regulation, and increasingly heroin use became an issue for police and courts. And then moving into the 1980s, the numbers of people using heroin was definitely increasing, as you can see from the figures here. And of course, that's just the sort of quote known heroin addicts. It was very widely appreciated that the true number was a lot higher. And for anybody who, like me, grew up in Britain in the 1980s, you might remember these kinds of advertising campaigns, these public health campaigns under the sort of banner of heroin screws you up. As you can see from these posters, they're very much targeting young white teenagers, men and women alike, and trying to impress upon them the message that this is something that will sort of ruin their lives. So there was a lot of public anxiety about heroin in the 80s. So when it comes to drug use in prisons over the 20th century, there's actually a similar sort of pattern. In that it's very low profile, really, over much of the 20th century. There were very, very small numbers of people being sentenced for drug-related offences for most of the 20th century. There was absolutely no acknowledgement whatsoever of people using drugs in prisons right up until the 1990s. That's probably not terribly surprising, but what is maybe more revealing is the fact that there's not much reference in prison memoirs, so books published by people who'd spent time in prison. They don't really mention drug use at all. They do talk about things like illicit alcohol, brewing and consumption. They talk a lot about cigarettes and cigarette smoking. But other kinds of substances really don't get much mention at all, which does suggest that there isn't really much drug use within prisons up until so moving towards the end of the 20th century. But with that sort of heightened public anxiety about drugs in the 60s and 70s, the prison service did start to collect statistics on drug dependency from around about the 70s. And those were published in annual reports. So, for example, in 1980, the Prison Service for England and Wales counted 1,003 people entering the prison system who were classed as having drug dependency. And just for scale, the total prison population during 1980 was standing at about 44,000 people. So it was not entirely invisible, but it was a fairly small scale problem. And when it came to treatment for people, those sort of relatively small numbers who might have been entering prison with drug dependency issues, the situation was quite different compared to the treatment that people in the wider community were receiving, especially during that sort of mid-20th century period when GPs in the community were prescribing heroin. This is what the prison medical service was sticking to, the abrupt withdrawal approach, which is summarised here from 1926, that the addiction drug would be abruptly cut off and certain remedial measures would be adopted to address the symptoms. and among those remedied were things like hyoscine, bromides, chloral, and alkalis. But almost as important, really, as those drugs to address the symptoms, as far as the prison medical service was concerned, was the regular routine of prison itself, the regular routine of regular meals, sleeping, exercise. I think a lot of prison doctors felt that that in and of itself almost was all that was necessary. And that approach remained more or less unchanged for most of the 20th century. Although the specific drugs that were being prescribed to manage withdrawal symptoms did change, the broad brush approach was fairly static. And one researcher described it towards the end of the 20th century as inadequate and often inhumane in comparison to the kinds of services that people could access in the community. So that's the context of drug use into which HIV and AIDS emerged in the 1980s. Nowadays, of course, people with HIV can be perfectly healthy and live a normal life with treatment and are not necessarily infectious to other people. Innovations with PEP and PrEP are amazing, but it is worth remembering that in the 1980s, of course, this was a new disease. It was quite overwhelming, terrifying. It was very, very poorly understood. And there was no meaningful treatment at all. People were dying in very large numbers, including young people. And there was a huge amount of stigma and hostility towards people with HIV and AIDS, as you can see from that newspaper clipping. I'd shoot my son if he had AIDS, says Vicar. That's from The Sun, of course. So it's hard to overstate really just how much fear and concern there was about HIV and AIDS. That was felt at first in the 80s by gay men, activists and healthcare professionals who were sort of on the front line and could really see what this meant. Policymakers were a little bit slower to catch on. But by the mid to late 1980s, that sense of crisis really had begun to permeate more widely, including government and policymakers. And we had the National Education Campaign, Don't Die of Ignorance, that you can see on the billboard there. So that sense of crisis was building. And for addiction services, what it enabled really was an increasing interest in harm reduction in community drug services. So in a sense, it enabled a bit of a return to that earlier model of prescribing, of treating addiction as a medical concern. And it also opened the door to things like needle exchanges or the provision of sterile injecting equipment to try to make sure that if people were going to continue to inject, there would hopefully be as little risk of bloodborne infection as possible. The issue of HIV and AIDS for prisons came up very early on, really, for these three main reasons. Firstly, the prison population was seen as being at higher risk for HIV, mainly due to the sort of disproportionate prevalence of injecting drug users entering prisons. Secondly, there was, and this is particularly really in the early 1980s, before HIV was very well understood, there was a strong feeling that prisons were just places of contagion. They were just unhealthy places. And that's a feeling that goes back hundreds of years. Because issues of poor hygiene and overcrowding are recurring ones for prisons. So it was felt quite widely that they would be potentially places where HIV might spread. and concerns around violence within prisons, and also unprotected sex and needle sharing started to come to the fore amongst people working on HIV and AIDS. But really the most common and probably most persuasive argument for addressing HIV in prisons was this third point, and this is using the language of the time, that prisons could be a bridge between at-risk groups, minority groups, and the quote-unquote heterosexual majority. And this was expressed really clearly in a lot of research coming out at the time, that if people were contracting HIV in prison, they would then be released and potentially go on to infect their sexual partners. And in that way, HIV would sort of escape into the heterosexual community. Just as a side note, it's quite interesting that a lot of research from the 1980s conceptualized people as either an injecting drug user, or as LGBTQ, or as a sex worker. There wasn't much sense of any kind of overlap between those categories at first. So there was this fear that injecting drug users who were probably heterosexual would enter prison, potentially be infected with HIV, and then return to their partners afterwards and infect them. And I have a quote that I'll put up in a second about sort of showing how this was expressed at the time. It's from a Conservative MP speaking in 1989, and it's quite unpleasant in its language, I would say. So this MP said that he suspected that AIDS was rampant in prisons, that prisons were probably one of the most fertile AIDS breeding grounds, and the danger was that when inmates are released, they will unleash the disease on an unsuspecting heterosexual population. So all of a sudden, thanks to that kind of really deep fear of HIV and AIDS, and specifically a fear that it was going to be unleashed onto an unsuspecting population who weren't in prison and were heterosexual, that put a lot of pressure on prisons to do something differently in their approach to drug use. So prisons did have to change. They could no longer really just sort of deny and ignore, and into the late 1980s, they did start to put the issue of drug misuse on their agendas. It starts to appear in annual reports. This is one example from 1989, where it was one of the 3 priorities of the prison medical and nursing services, alongside HIV and AIDS and mental illness. There was a new policy on drug treatment in prisons launched in 1987, which was actually quite good. It was drawing on multidisciplinary approaches, including counselling, clinical treatment, and so on. But really importantly, it left everything to the discretion of the local prison medical officers. And what that meant in practice was that experiences would vary really radically in different locations. And one doctor that I spoke to, who'd been very active in as a GP in addiction services in his local practice in Liverpool, felt really passionately that all of his good work was undone as soon as people entered prison, because prison doctors were absolutely sort of unshakable in their conviction that things like methadone prescribing was absolute nonsense. They wouldn't entertain it. So what happened on the ground could be very variable. Another thing that was changing over these years was drug use in prisons itself. And this is a quote from Mike Trace, who in the 1980s, early 80s, I think, was working in the probation service. Went on to do all sorts of things in relation to drug policy and drug services. And this is what he was noticing in the 1980s, that his probationers were discovering that they could make more money drug dealing with less risk as compared to the kinds of robberies and things they'd been doing previously. And a high proportion of guys in the hostel that he worked, which was a release hostel for people coming out of prison, were reporting that there was a heroin market inside, there was a culture developing around it, and it was becoming part of their normal life. So at least in some prisons, drug use and specifically heroin use was becoming much more prevalent. Although it's worth saying that prisons did not acknowledge that for a little bit longer. Things then did start to change somewhat in the 1990s, partly thanks to the ongoing fears about HIV and that fear of the spread into the general population, but also thanks to the introduction of mandatory drug testing, for which we can thank Michael Howard, the Home Secretary at the time, shown here. The aim very much was to make sure that prisons were all drug-free by catching people who were using drugs in prisons and punishing them. But perhaps one of the main things that it actually achieved was highlighting how serious the problem and widespread the problem of drug use in prisons really was. Another really important thing over the 90s was much more collaboration between individual prisons and local organizations, local drug agencies, local HIV organizations, and local health authorities to take their work into the prison. That had been sort of recommended and encouraged for all sorts of reasons. One of them was financial, in the sense that prisons tended not to have much budget for health-related services, and there had been a lot of money made available for anything relating to HIV and AIDS. So local organisations have been able to tap into that funding and were then able to come into prisons to deliver services. Another reason was that prisons were seen as a great place to access underserved communities. And one person I interviewed remembered lots of what he called radical gay men working in local health authorities who felt really passionately about going into prisons as part of their anti-HIV work. So all sorts of new kinds of agencies and individuals were coming into prisons over the 90s. And I think it was also often welcomed by prisons themselves, because it was recognised that it was a way to disrupt the monopoly of the old prison medical service, which was increasingly isolated as something entirely separate from the NHS. A lot of prison staff could sort of turn a blind eye. There were tacit agreements in place that prison staff might just leave the room while these external parties spoke with people in prison to talk about things like harm reduction and harm minimization around injecting that prison staff couldn't mention. And the final thing that I wanted to refer to quickly to give an example of this change in action and its limits was the first detox unit in prisons, which was set up in Holloway in 1997. It was set up by someone commissioned from the NHS. So again, it was an external person coming in. And her detox unit was able to move from what she called 5 days of DF118 and stop, which is quite similar to that 1926 description of dealing with addiction, to move to something more humane. But once she'd done that, she did then say that she'd realised that detoxing people was not the way we should be going. We should be offering them maintenance and extended regimes and so on. But there was a contractual barrier because they had been brought in to just detox everybody. So it was a really important innovation. But once external experts and service providers came into prisons, they often faced quite a difficult reality. So that brings us up to the year 2000. which is where my knowledge more or less stops. So we saw HIV and AIDS really increasing interest and focus, and to an extent resource, for drug use and addiction in prisons gradually over the 80s and 90s. But moving into the 2000s, I think things changed a lot, with the NHS becoming more involved in prison health services, lots of new policies, lots of new strategies around drug use and addiction, lots of new communities of expertise springing up. And of course, lots of new drugs, new psychoactive substances arriving alongside those sort of old drugs like heroin, all presenting new challenges. So that's where I will end, to hand over so that we can learn about something from the much more recent past and present day. Thank you very much.
Lovely. Thank you so much for that, Janet. That was really interesting to see the timeline there of how things have changed. I would say developed, maybe not always developed, but in some ways over the years. So that's brilliant. Thank you. Continue to put any questions you have for Janet in the question and answer box, and we will get to those at the end. So I will now introduce our next speaker, who is Denise Lyons. Denise is a registered adult nurse and is the governance lead in the healthcare and prison team covering all prisons in Northern Ireland. Denise has over 30 years experience in clinical governance roles across the voluntary, private and public sectors. She has been working in her current role in prisons for 11 years. She won the Inspiring Excellence Award at the Northern Ireland RCN Nurse of the Year Awards 2022 for leading on the comic book project Biz in the Pris. And Denise is now going to tell us all about that in her talk on Biz in the Pris, Nursing Interventions into Drug Awareness. So I'll hand over to you now, Denise.
Thank you very much, Sarah, and thank you, Janet, for that very interesting presentation. It'd be hard to follow. And also to Sarah and her team for setting the presentation up and inviting me to speak. So I'll just now share my screen and start the presentation. Okay, everybody, so this is Hyde Bankwood College, one of the prisons in Northern Ireland. It's a secure college, and it basically houses young men and women in Northern Ireland. Currently we have probably about 170 people living there. The project involved the young men there and the Young Offenders Centre, who are aged 18 to 21. And this is just a selection of some of the healthcare staff with the previous governor. And we set out to develop a methodology of how to get a serious message across to men, these young men, in a very sort of fun way. And as you all know, secure environments are one of the most challenging settings for nurses to deliver care in the 21st century. And they're a very vulnerable group. Very hard to engage, and certainly really are not interested in formal healthcare leaflets or any type of what they perceive to be boring. Next slide, please. Okay, so the people that were involved in this project were, I left to right, Zoe Gray. That's Zoe and myself at a prison arts exhibition, and on the right is Mr. Bobby Matheson. Zoe was on an undergraduate student placement with me from Queen's University Belfast, and had a specific interest in doing things differently. She was quite artistic and wanted to think outside the box. The other person involved in the project is Mr. Bobby Matheson. Bobby had served a life sentence in prison in Northern Ireland during and after the Troubles. He had learned art in prison and then became a volunteer for the Prison Arts Foundation. So he came in to help others learn art, and he was able to speak very much about how art had helped him while he was in prison to deal with his thoughts, his feelings, and he's been a very good mentor to some of the young men. Zoe has since graduated, completed her master's, and she is now working as a trainee clinical psychologist with the probation team. So she is doing very well. She absolutely was so engaged during her time in prison, and Bobby provided the artistic direction and input and probably comedy to the comic book. So this is basically the logic model. The problem of significant drug use in prison and the community was identified. Drug-related deaths are increasing every year in Northern Ireland, with opioids and benzodiazepine the top 3 drug-related causes of death since 2006. So the aim was to develop a new methodology to empower people to change their relationship with drugs through creating a method relevant and meaningful to them. So the comic book was agreed as a means to how to do this. And as I've said, I have no artistic ability, but I had a passion and have a passion for improving healthcare and prisons, so set up and led the project steering group. So the project group then evolved to include 8 services working in prisons. So that was across obviously addictions, mental health, we had pharmacy input, we had the prison service disciplinary staff involved, and Biz in the Pris version 1, called Craving the Blues, was born. Next slide, please. And sorry, that's another slide. I think I've forgotten to tell you to move that one. No, sorry, the next one and the next one. We're past the comic lodge. The next one, please. Yes. So, and I keep losing my place here. I'm not doing very well at this technology. So workshops were set up with the young men, and these were men that were asked would they like to engage in this project, and we were amazed by how many people came forward. They were fully engaged, and these were men who had drug use issues, and we were totally blown away by the stories and the pictures that they produced. And without their engagement, the project wouldn't have been possible, because it was essential that it was relatable. It was a language that's used in prisons in Northern Ireland. It was probably Belfast slang. And we had to get permission from the Northern Ireland Prison Service to use the slang words and swear words within, because we knew then it would be in circulation within the prison. And they were very agreeable to that. So it was very much co-production in progress. Bobby assisted them with artistic content. Now Bobby does do some very more professional drawings, but he kept this very basic to assist the boys just to do make the comedy element of it come to life. And his previous lived experience of prison provided great support to the boys and the wider project group while we were actually devising this comic book. Okay, next one, please. So this was the result. Biz in the Pris, this story is a young man called Diazaman, and he is living in Hyde Bankwood Secure College, and he's abusing the medication diazepam. He's causing problems, having fights with his drug enemies, and he's sent to the segregation unit for behaving badly. As a result, he decides to change. He thinks about it during his time in segregation. He's all on his own, and he just decided that this is no more what he wants to do. So with support from the nursing staff and the addiction workers, he changes into mentor man. So he helps others stop using drugs. So there's a part in the comic book where he bursts out into a new person, and then he becomes a new character. The results surpassed all our expectations, and the comic book is an incredible achievement, considering there was no professional involvement, there was no specialist apps used in developing or editing it, and it was simply produced by amateurs drawing pictures, scanning them, editing them using Microsoft Word, and putting them on pages to make a booklet, and the finished product then was sent directly to print. So there was absolutely no professional input in this publication. Next slide, please. So we had a launch. And the interactive lively lunch took place in Hyde Wood Secure College. It was an absolutely fabulous evening. We had invited very many people, stakeholders, and we had also invited some of the young men's families in for the occasion. It was a most enjoyable night. So we had cake. You can see that there in the picture. We had board members from the South Eastern Trust, and the supports meant so much to us all, but especially the young men. And they were saying that for weeks afterwards that they were buzzing, and they've said this wasn't from drugs for once. This was from the buzz of having done something well. I've so much pride in the team, and I've so much pride in the boys involved in this project. And it was really the first such initiative in a prison in the UK. So the next slide, please. So this was some of the feedback from the young men that were involved in it. Good crack, that's a great saying in Northern Ireland. I'm sure you've heard of it before, which just means good fun, really. And boys said that would give them a real motivation to come to the workshops and do something different. And they got so much positive feedback on the comic book from their peers in the Landons, who were really impressed with it, and said it was a much better way to read a leaflet than to have to read a stuffy, in their words, healthcare leaflet. Next page, please. So the comic book achieved its objective of raising awareness of the dangers of drug use, and it's notable that self-harm incidents in the Secure College reduced more than 50% from the same period in the previous year, pre-issue of it. Significant nursing time has been freed up then from providing emergency response and a lot of support to people with addictions, to providing proactive care, including therapeutic interventions. We came up with the idea that it would be really good to give all of the young men who participated in the project written references, skills certificates, and certificates of achievement. Because, as you know, when these young men are released from prison, they really have very little opportunity to gain employment or even voluntary service placements or something for the future. So this was very much well received by these young men, and they really felt somebody was believing in them. So we believed that the benefit of that was immeasurable, giving them hope for the future and the motivation that rehab can and is a reality. Demand for the comic book has been huge across all the sectors in Northern Ireland, the Trust Voluntary private and community addictions organisations. It was disseminated widely, although it's somewhat slowed during the COVID pandemic. But we've always said if Biz in the Pris saves one life, even a juvenile, from going down the destructive road of drug use, then we will be truly humbled that it served such a purpose. Michael, one of the young men that was part of the project, and which basically a lot of the stories based on his story, became then the addiction mentor in the Secure College for others, and is an excellent role model. His mother was very, very emotional the night that we did the lunch, when he was able to stand up and say that he felt that having been involved in this, having had the crack, as we say in Northern Ireland, doing this project, he was drug free, he was clean, and his mother was so emotional. It really was really, really emotive. As you heard, it did win the Northern Ireland Nurse of the Year Award for innovation, and we have been approached by the UTV channel, which is the regional channel of ITV, to scope film in a documentary. We're progressing a second version about self-harm by other means, and we're very confident that the comic book will become a regular publication. Next slide, please. Okay, so the survey was conducted 6 months post-introduction, and that indicated that 100% of the people who were randomly selected said that they had read the comic book. And you can see the other comments there, that really was what we had set out to achieve. We knew that people didn't read leaflets, they weren't interested in finding out help through books or any sort of that type of format. So the feedback was overwhelmingly positive. Next slide, please. So it has increased the awareness of the dangers of illicit drug use, and people in custody now are more likely to seek help. It gives them hope of rehabilitation. And as I've said, some are no longer using illicit drugs. These young men, marginalised in society, were involved at all levels, including representation on the steering group to actual participation in the art workshops. Peer mentorship in prison is proven to be an effective support mechanism, and others have seen the real benefits of being involved in such a project, so recovery is real. And then the spread of the comic book and new versions being planned means that we believe that this will be sustainable. Next slide, please. And this really is just a slide to demonstrate how this ties in with the Northern Ireland nursing strategy and 10-year plan. And that's basically about person-centred care through enhancing nursing roles across services. So this is really a new way to think about it. It's a new type of caring, and it's been so effective. It is just wonderful to see it. Next slide, please. And we often say maybe these messages can say more than any presentation can. These are some paintings done by people in prison. And the background to that is some of the sketches that the boys did while they were in the making of the comic book till they got it firmed up. It really demonstrates the power of engagement by nurses in art, and a belief that by dedicated, resilient and genuine caring nursing staff, we can help a marginalised society. And the next slide, please. And this slide speaks for itself, really, about, again, the power of engagement and real engagement and the escalating power of that. But it also summarises my journey and experience of working in a prison from where I started to where I feel I am now. And on to the last slide then, Sarah, please. So I hope you've enjoyed my presentation. This is just a tweet from the Director of Nursing. And at that time, we were planning to get student nurses into the Hyde Secure College, and that has been very successful. And we have had many students who've actually come back to work as registrants within the healthcare and prison team in Northern Ireland. So thanks very much for listening, and I believe that Sarah will be able to circulate a PDF version of the comic book to anybody who's interested following this presentation tonight.
Thank you, Denise. That was really, really interesting, and I can really see how proud it really came across, how proud you are with that work, and that collaboration, as you said, with the service users is key, isn't it? Really, absolutely, to have their voice, and the fact they've been part of that whole process. It's really amazing. So well done for what you've achieved there. So yeah, lots of hearts going up there for you, as you may see on the screen.
Thank you very much, people, for the hearts. I really appreciate it.
Okay, so thank you to both of you for those wonderful talks that you've given us this evening.